Dylan, you got the clicker?
What?
Give it a roll. Okay.
Thank you.
Oh, hey, it's working.
Good, very good, very good.
It's gonna move it.
Thank you.
Did everybody get one or two?
All right, Logan, you ready to go?
Yeah.
Thank you. Duke, you ready to go?
Yes.
All right, take a deep breath, and everyone pay attention. The floor is yours, guys.
I'm Dylan,
I'm Laura. I'm Chloe.
and we did panic disorder and the fight against your own mind. Okay, so history. So there really wasn't much history on panic disorder because it's so similar to anxiety disorders. So it wasn't recognized until 1980 by the APA, and before this, they just thought it was over excessive stress and nerves. So they kind of, if you like went in saying you had a panic attack, they're just like, well, just calm down, you'll get over it. And then in 1980, they diagnosed it, and so more and more people that came in, they were saying, yeah, you got a panic disorder. So they started like preventing it at earlier ages, and causes are from high stress or family. Actually, I think that's no. Causes are family history, abnormalities in the brain, substance abuse and major life stress, and poor nutrition. Disabilities that can come from it are agoraphobia, the fear of being in unfamiliar places, drug and alcohol abuse, and depression. And then after 1980s, so in most of these disabilities can be prevented with early diagnosis and treatment. And then, so recently, more and more people come in, and with media, people have become more aware of panic attacks and panic disorders, and not just saying that it's from high stress and nerves. So they've been treating it better, and so now it's more and more normal to have a panic attack and go to the doctor and get it fixed instead of just waiting it out.
Okay, so before I dive into my diagnosis, I'd just like to define panic disorder. So panic disorder is a series of unexpected attacks of intense fear. These usually last from minutes to hours, but generally it lasts about 10 minutes, but it can have a maximum of an average about 45 minutes. And genetics may play a role for identical twins. If one identical twin has it, the other one's like 40% likely to experience the same thing. And also, panic disorder occurs in family members that are not actually blood relatives. And there's a lot of symptoms, obviously, but if you guys want to look at the panic disorder fact sheet, there's a synthesized version of the symptoms. I'll read off these though. Chest pain or discomfort, dizziness or faintness, fear of dying, fear of losing control, feeling of choking, feeling of detachment, feeling of unreality, nausea or upset stomach, numbness or tingling, palpitations or pounding heart, sensation of shortness of breath, sweating, chills, or hot flashes, trembling or shaking. And panic disorder affects 2.4 million Americans, and often it begins during late adolescence and late adulthood, and it's twice as common in women than in men. And is there anything you guys want to cover between mine and Dylan's slides? It's actually on the panic fact sheet. So this is a diagnosis visual. There actually isn't any specific treatment you can get for panic disorder, but the doctors usually do a series of medical exams just to see what their symptoms are. And if things come back negative, usually the patient is given to a psychiatrist who works on their mental health. And usually, like, the diagnosis is based off of the frequency and intensity of the symptoms, as well as the the amounts that you give during like a week or a month. And you see on the right here, this is about like what the average person looks like when they're having a panic attack. She has a bag over her mouth because she's trying to slow her breathing. And when you do that, it calms you down because it makes the hyperventilating stop. And this is what most people look like before they have a panic attack. They look really stressed out and pale, and they obviously look sick because of all the stress. So this is before, not after. It's like before a panic attack. And then this man right here, it looks like because he's in an elevator or in a work environment that he's stressed out due to work things, and that actually has a lot to do with panic disorders, especially in our society. Like, people get stressed out because of all the things that are going on in their lives due to work.
So this is Shangela, and and she has a history of chest pains, dizziness, feelings of choking, some nausea, upset stomach, numbness, and shortness of breath, sweat, and chills. When Shangela was born, she was dropped, and now she was dropped twice, and now she has a fear of being alone. And due to many people leaving her throughout her life, she also has some trust issues. And Shangela's family history includes cancer and many psychological disorders. And Shangela's panic attacks had started when she had a German exchange student come over and stay with her for a month. And the day that he was leaving, her mom allowed her to play rookie and go with her to send him off in the airport. And when she got back from her entire day, she just was upset. She has not stopped crying since he left. And she was just really, really, really depressed. And because they've basically grown to be like brothers and sisters. And her mom had to go away for the night to go do some meeting. And then she goes into a frenzy and starts thinking that people are in her house, and she just runs around the house crying, and she stares at the mirror and just screams, and then leaves the house. And then she has a family friend come with her just to comfort her, and then her mom comes home, and then they talk about it. Shangela is all better now because she submerges herself with loving people and discuss the matters and the panic attack with her parents and the people that care for her. She has talked to a professional about her codependency. She takes her Xanax regularly, has strong friends who support her and make sure she never feels alone again, has talked with her school counselor to take the necessary precautions for if another panic attack comes up, and she seeks help instead of just letting it getting worse, and she believes in herself more fully and can see a brighter day ahead. And as Chloe said, it's not really something that you can just treat right off the bat with just easily like everything else is treated. So it's basically mentally treated, so you have to make the mind calm down. Other alternatives besides Xanax are theanine that can be found in green tea. It produces tranquility within 15 minutes or so, and it releases dopamine. GABA, there's an amino acid, and its main inhibitory, the neurotransmitter. I'm not a scientist, I'm a psychologicalist. In the brain, prevents muscle tension and produces endorphins, which we all know as endorphins makes people happy. And happy people just don't shoot their husbands. Ashwagandha root, I can pronounce that one though. Used in Indian traditions, it's an antioxidant that can treat the main causes of main disorders that are also related to panic attacks. Brahmi, it's a mild sedative that supports the body during periods of emotional stress, usually promoted to prescribe cognitive functions. And you can find way more on the other panic disorder fact sheet. It's going with pictures.
They're all on there. So the ones we just read off are actually ones that are on this packet, and they all have pictures next to them, so you can get a visual of what they look like. And all these are all natural supplements that you can take rather than taking pills. They can sometimes hurt your mind mentally because you take so much of it and you become dependent on it. So these are like the natural supplements besides just like what Laura was saying for Shangela. Shangela like put herself around a lot of people because she had an anxiety attack due to she was losing people, and she felt like she lost someone important in her life. So she submerged herself in a group of people and kept herself active to get over that stress that she had. So besides like taking supplements or anything like that, you can just like figure out what's causing the problem and then try to get yourself away from that situation or get yourself more involved.
Yes. This is our works cited. Any questions? No questions? Don't be shy. You can ask us
We
a
have
question.
answers.
We do. We're psychological.
I have 11. She's not answers, yes.
We have lots. You sure there's no questions?
Good job. 36 seconds over.
Good morning, mother cracker.